video lecture is about the therapeutic uses and adverse effects of cotrimoxazole. To understand the therapeutic uses of cotrimoxazole, it is important to know the antibacterial spectrum of cotrimoxazole. So speaking of the antibacterial spectrum, sulfonamides are highly active against gram-negative bacteria such as E. coli, Salmonella, Shigella, Proteus, but it is not active against Pseudomonas aeruginosa. Therefore, sulfonamides should not be used for the treatment of infections that are caused by Pseudomonas aeruginosa. Cotrimoxazole is moderately active against Neisseria gonorrhoeae and Neisseria meningitidis, Nocardia species, and it is also active against atypical organisms such as chlamydia. So coming to the therapeutic uses of cotrimoxazole, the first indication of cotrimoxazole is urinary tract infection. The commonest organisms causing urinary tract infections are E. coli and Proteus mirabilis. Since cotrimoxazole is highly active against gram-negative bacteria such as E. coli, uncomplicated cases of UTI rapidly respond to cotrimoxazole. However, resistance of E. coli has emerged in recent times. So, one tablet of cotrimoxazole used twice daily for 5 to 10 days is very useful for the treatment of urinary tract infections. The second indication of cotrimoxazole is prostatitis. Since cotrimoxazole gets concentrated in the prostate gland, it is highly useful for the treatment of prostatitis, which is caused by bacterial infections or non-infectious factors. Acute prostatitis is commonly caused by bacterial infection, namely E. coli, and since cotrimoxazole is highly active against E. coli, it is useful in the treatment of acute prostatitis, which presents as fever, chills, urinary urgency, and pelvic pain. If the patient is allergic to sulfonamide, which is a component of cotrimoxazole, trimethoprim can be used because trimethoprim, being a basic drug, gets trapped in the acidic prostatic tissue, the prostatic fluid, and therefore it is very useful for the treatment of acute prostatitis. The third indication of cotrimoxazole is respiratory tract infection. Cotrimoxazole is a frequent choice drug for the treatment of respiratory tract infections such as acute sinusitis, acute bronchitis, otitis media, which is caused by bacteria such as pneumococcus and Haemophilus influenzae, which is a gram-negative bacteria. And since cotrimoxazole is highly effective against gram-negative bacteria, it is highly useful for the treatment of these infections. It is also useful for the treatment of pneumocystis carini pneumonia, particularly in AIDS patient and in immunocompromised individual. So, cotrimoxazole at a dose of 1 tablet 4 times in a day for 2 to 3 weeks is effective. It is curative of pneumocystis carini pneumonia. It can be used prophylactically at a dose of 1 tablet once a day. So, cotrimoxazole at a dose of 1 tablet twice daily for 2 weeks can be used for the treatment of typhoid fever. However, a course of 10 to 12 weeks can eradicate a carrier state of Salmonella typhi. The next indication, cotrimoxazole is effective in the treatment of acute gastroenteritis or bacterial diarrhea or dysentery, which is caused by organisms such as Salmonella, Shigella, Yersinia, Vibrio cholerae, causing traveler's diarrhea. The next indication of cotrimoxazole is nocardiosis. Nocardiosis is a rare but serious bacterial infection which is caused by Nocardia species. It primarily affects the lung, but it can also involve other parts such as brain, skin in immunocompromised individuals such as AIDS patients. So the treatment of nocardiosis typically involves prolonged use of cotrimoxazole, that is a combination of sulfamethoxazole and trimethoprim. Next is the use of cotrimoxazole in various sexually transmitted diseases such as chancroid, non-specific urethritis, LGV, or lymphogranuloma venereum, and gonorrhea. So, cotrimoxazole is the drug of choice for the management of chancroid, which is caused by Haemophilus ducreyi, a gram-negative bacteria. It also treats gonorrhea, which is caused by Neisseria gonorrhoeae. It is effective in the treatment of non-specific urethritis or LGV, which is caused by chlamydia species and atypical organism. Therefore, cotrimoxazole is useful in a wide range of sexually transmitted diseases. Lastly, cotrimoxazole can be used for the treatment of a rare bacterial disease, that is melioidosis, which is caused by a bacteria that is Burkholderia pseudomallei. These bacteria are found in soil and water, and infection occurs through contact with contaminated surfaces or inhalation. So the symptoms may include fever, pneumonia, abscesses in various organs, joint pain and sepsis. So if untreated, the patient can progress to septic shock. So the treatment involves initial intensive phase of antibiotics with meropenem and ceftazidime, which is followed by oral cotrimoxazole, a combination of sulfamethoxazole and trimethoprim. Now coming to the adverse effects of cotrimoxazole when used in AIDS patients, there is higher incidence of hypersensitivity reactions, fever and agranulocytosis. Also, it is to be noted that long-term use of cotrimoxazole can lead to folic acid deficiency, leading to megaloblastic anemia. And this side effect is more common in susceptible individuals such as malnourished individuals or alcoholics who are more prone to folic acid deficiency.